Hi, everyone. Welcome. As we wait for some more people to filter in or trickle in, why don't you drop a note in the chat and let us know why you're interested in the conversation today or why you joined. As well, you'll notice that our webinar format is a little different. As it says in the chat, we're using a platform called On24. So it's sort of a choose your own adventure experience. You'll see the screen and presenters at the top and the slides. Below, you should be able to see some tools and some more material to help you get started on your wayfinding journey. If you don't, there's probably 3 little buttons that you can click and get some of that up. As well, there's a attendee chat on the side, and that's where you can drop in why you decided to join today. We'll get started in just a minute. Okay. Getting some answers in the chat. Interested in hearing about Corewell's experience with rebranding. So we'll hear about what Lori's been up to at Corewell. That's so important for easing the way of the patient and their experience and integrating with online wayfinding. Absolutely. So we'll hear about that today for sure. I'm here because wayfinding is current focus of ours and looking forward to learning from the experts. Well, hopefully you'll learn some things to take away. All right. I think we'll get started. All right, so welcome again, everyone. Today's conversation is about something we all intuitively understand but don't often name, and that is, how do people find their way in complex environments? Well, you'll find the focus today on healthcare, given our guest, Lori Bruins. The principles remain the same, whether you're in healthcare, higher ed, or transportation hubs. Wayfinding isn't just about signage. It's about how patients, families, and staff experience your brand from the very first touch point. And when it's done well, it can build trust. And when it fails, it adds confusion and stress. And that's especially true for people who are already vulnerable. So today we're here to explore how wayfinding is not just a support function, but a strategic imperative. And this is your opportunity to rethink, realign, and reconnect your spaces with your values. So let's take a moment to introduce ourselves. I'm John Levy, a senior director at Brand Active. Brand Active has been in brand implementation for over 25 years, and we got into it because no one else was solving for it. And while in this space, what we saw over and over were the same wayfinding challenges across clients, unclear ownership, misaligned touch points, and inflated budgets. That's why we built a dedicated wayfinding practice. And we bring a unique lens because we sit at the intersection of facilities, brand, and finance. So that allows us to build wayfinding strategies for you that can scale and support your long-term strategy. I'm in my 4th year with Brand Active, and prior to that, I spent about a decade in operations consulting, mostly for world-leading hospitality brands like Marriott and Hyatt. For them, we would examine the operation to improve processes, increase profitability, and guest experience, which includes wayfinding. And it's that lens that I bring to Brand Active, where I lead our wayfinding offering with my colleague Vivian, who you'll hear from in a minute. And I also oversaw the work we did with Corewell Health, helming the implementation of their rebrand, which one random person said on LinkedIn was her Roman Empire due to the proliferation and speed that the brand appeared.
Hi, everyone. I'm Vivian Lin, the design director here at Brand Active. So my background is in graphic design, branding, marketing, signage, and environmental design. What I'm really passionate about is creating meaningful, human-centered experience that help, whether it's users, guests, patients, even my clients, connect more deeply with the space and the content. I've done work across industries, think hospitality, transportation, financial, healthcare, retail. And what I really love about that is I can cross-pollinate ideas to tackle some of the wayfinding and communication challenges in more creative ways, taking things across industries. So I'm excited to get the conversation started. And over to you, Lori.
Thanks, Vivian. Hi, everybody. I'm Lori Bruins. I'm a consumer experience manager with Corewell Health. Corewell Health is the largest health system in the state of Michigan, recently having combined 2 large systems together. So I've been with a piece of the system for 28 years, starting at a regional hospital, Zeeland Hospital, then became part of Spectrum Health, and then Corewell Health. For the majority of those years, I was really focused in the patient experience space. And then I joined our newly formed corporate experience, consumer experience team in 2022. So just to give a little view on how we view consumer versus patient experience, consumer experience really focuses on those big, wide system opportunities on how we can make it easier for our patients, wayfinding, billing, scheduling, registration, while allowing the patient experience team to focus on the care experience itself. So while we take a broad look across the system, they can focus in on specific locations and service lines. And I'm really happy to be here today.
Great. Got some more comments. Looking forward to hearing about wayfinding beyond signage. I love that. Definitely we'll get into that. Impacts of having a well-defined strategy, definitely. And then kind of the ins and outs of a rebrand and signage. Those are all things we'll be touching on, and best practices as well. Thank you for everyone attending in the chat. So we're going to start with a really quick poll. Have you ever gotten lost in a hospital? Could be an airport or university campus.
And you just click the answer on the screen. Okay, have a bunch of submissions.
I got a yes in the chat, so adding another yes. Okay, so obviously the answer is not surprising. Getting lost is a universal feeling, and we've all experienced it. And while we joke about it, it really isn't a small thing, especially when we think about for patients, it can mean missed appointments, elevated stress, or even delayed care. So this poll really what it reminds us of is that we've all been there. And we've all been there, even though we're professionals. Just imagine how it feels as patients under stress. So this is more than a facilities issue, it's more of a human experience issue.
And on that, I want to start today not as a strategist or as a consultant, but with my very own patient story. So I've lived with Crohn's disease since childhood, which meant I spent a lot of time at our local children's hospital, McMaster. Now, back then, I didn't know the word for wayfinding, but what I did know, even when I was a kid, was that hospital just made sense. From the moment you stepped into the lobby, you could tell where you were going. There were 4 color-coded quadrants, which you can see on the screen: red, yellow, blue, and purple. Everything matched. You looked one way, you saw elevators and doors. You looked the other way, you saw accents. Even the parking garage columns were colored to match the section you were in. And the room numbers weren't random either. So they started with a number for the floor you were on, a letter for the wing, and the letters were consistent across every level. As a child, I never got lost. I didn't even think about where I was going or how I was navigating. I had appointments all over the hospital, running, leading the way with my parents, in tow behind me. I remember to this day that my doctor was in red 3F, and nuclear medicine, where I would get scans, was in blue 2Q. That's a mouthful, blue 2Q. That's how seamless it was. So fast forward about 15 years, and I'm in Copenhagen for grad school, and I ended up experiencing a severe Crohn's flare-up. Their health system was so incredible in so many ways. It's something I talk about often with family and friends, starting with the fact that they assigned me a family doctor when I got there for having a residence permit. So my family doctor had the ability to check my blood at her office. She saw serious inflammation, and she immediately called me a cab to get me to the hospital, which she said would be faster than an ambulance. I always found that a bit weird, but off we went. So we arrive, and you can see on the screen, there are 15 plus buildings. I can tell you in reality, there was 0 clear signage and no way to tell where registration was. But, then the cab driver, thankfully, was familiar with the site and got out and said, "Let me walk you in. You'll never find it on your own," which has always stuck with me, but not because of anything to do with wayfinding. It's more about how gracious that cab driver was. as I became more involved in wayfinding work, I did start to think about it. What would have happened if he hadn't have done that? Like if he hadn't have been familiar with the site, or if he wasn't so kind. I was in pain, I doubled over, barely able to walk, and I was about to undergo emergency surgery in a foreign country, and I had no idea where I should go. The contrast between McMaster Children's Hospital and my experience in Copenhagen is now something I think about in my work, right? One made me feel safe, independent, and cared for, and the other reminds me how vulnerable patients can be when that clarity is missing. And that's what we're really here to talk about today, because no hospital intends to be confusing. None of your systems intend to be confusing. But over time, as your campuses expand and renovation piles on after renovation and departments move, wayfinding strategies often evolve in silos or they don't evolve at all. So what once made sense becomes a patchwork of quick fixes, and that results in conflicting signals and confusion. And while incorrect messaging on a sign or a missing sign might seem minor, it's usually never just one sign, right? It's a symptom of a system that's no longer supporting your patients or your brand the way it could. So let's begin with the first big question. When is it time to stop, step back, and reevaluate your wayfinding system? And more importantly, how do you recognize the warning signs before confusion becomes crisis?
Right. So when do you know it's time to step back and reevaluate your system? As John mentioned before, most places evolve over time, adding buildings, your departments merge, running pilots. But the wayfinding strategy doesn't often evolve with them. Instead, it becomes, again, like John mentioned, patchwork, quick fixes, you get outdated signs, conflicting nomenclature, which that all equals to confuse patients and guests. So you'll start hearing things like, it's a mess, wayfinding gets dinged in our survey results, we just can't get it right, we can't keep designing for the middle. So these are all things we should be listening for. And if that sounds familiar, you're not alone and you're in the right place today. And feel free to drop any other signs you notice in the chat. And Lori, how many of these have you heard, and anything more?
Yes, Viv, I think we've probably heard every single one of these things. And I'll add, it takes our team members too much time because we've taught them well and they walk patients to where they need to go, but then they're stopped in their own journey. In our patient experience surveys, we hear a lot of feedback on wayfinding, signage, navigation, parking, all of those things that are part of that overall wayfinding strategy.
And to that, I also don't imagine, and I don't even myself, most people wake up thinking today's the day to rethink our wayfinding. But there are moments that become really clear that it is time to take a step back. So Lori, what sparked the decision for you and your team to step back and look at wayfinding across the whole system rather than just individual sites?
Sure. So we actually did start at an individual site, Blodgett Hospital. And the reason we did was because it had been in a constant state of construction for 7 years. It included shutting down the main entrance, tearing down the primary parking structure to rebuild them both. So navigating people had already been tricky at Blodgett, and now we were asking everyone to come in sort of the back door and navigate their way through. So it was worse. Then there's a secondary building that was now attached to the hospital, small changes over time that weren't consistent, wide variations, pilots, all with good intentions. People were working with good intentions, but it just got messier and messier. Then in the midst of that, the two systems merged. And so suddenly we realized there were no system standards. So we knew no one was really looking at the whole consumer journey from start to finish. And when I say that, I mean from the time a patient makes an appointment and the information they receive, all the way to getting them to the building. No one was looking at that, making sure it was all consistent and clear.
Yeah, and we heard some of that as well through our work together. And just to continue what Lori had mentioned, there are little cues that tell you, again, it's time to step back and take a fresh look. So the most obvious one, feedback and surveys. Are your staff and visitors frustrated? Similar sentiments to what was mentioned. That's probably your biggest first red flag. And then you want to look at organic campus growth and change. How has your space changed? Are people using the spaces a little differently? As well as incorrect or conflicting information. Are the signs saying one thing, but the website is saying another? And then on top of that, your staff is giving a different direction? Or when you notice site teams are creating their own solutions, are they making their own fixes, temporary solutions? That usually means something is not working. And I know a lot of you are here to think about rebrands as well. So on top of that, rebrands, these are big updates. And being able to take advantage of initiatives like a rebrand that already has a momentum has multiple benefits. So it saves you money by improving your wayfinding at the same time that you're updating your branding materials like signs, communication. Plus, it's a chance to elevate your brand, strengthen the trust, and live your brand values the way that's more inclusive and aligned.
It can be tricky even knowing where to start. There are many barriers to starting an improvement program, and that hinders progress before you even get going. And that brings us to our next topic: what stalls progress? So we're going to start with an audience poll. Drop your answer in the chat for this one. What's the #1 challenge you faced improving wayfinding? We're going to move on for now, and we'll circle back to some of those answers. Okay, so starting with a biggie: unclear ownership. No one owns wayfinding. We hear that again and again, and it's no one's fault. It really is a structure of the systems. Everyone owns a piece. Facilities handle signage. Marketing owns the brand. Patient experience owns the surveys and the complaints and the feedback. Operations handles the flow of people and the processes. EDI owns accessibility. And when everybody touches it, no one really owns it. And that creates challenges, such as no one's seeing the whole journey, which means no one's viewing it end to end. There's no clear decision-making authority. So everyone's making their own decisions without any sort of holistic outlook. There's duplication of efforts. Departments or sites solve the same problems multiple times, each in their own way. Lori, we've chatted about this, right? This resonates with you.
It does. I mean, we found the very same, all of those things that you just said, John. No one really owned the overall wayfinding process. And a lot of people think or thought that it's only about signs. So a lot of really well-intentioned people try to take it on at their site, utilizing the tools they have, but maybe not having the expertise or looking at the challenge holistically, as opposed to one-off problems. They would be fixing very specific things.
Right. And I think that's the key, right? A lot of well-intentioned people work with what they have, but they work in a vacuum. It's not holistic. It's a quick fix. It's not a strategy, and it's definitely not a standard, right? And that's because it's not strictly anyone's job. No one has holistic wayfinding strategy in their job description, right? And here's what happens as a result. So you get updates that happen reactively, not strategically. Departments improvise their solutions. Staff become de facto navigators, walking patients or visitors back and forth. Wayfinding is an afterthought in capital projects instead of an input. And no one feels empowered to take initiative. All of that results in lower experience metrics, which suffer, efficiency is hindered, and that hurts your bottom line. And it's not that people don't care, right? People care, you all care, your colleagues care. It's that no one has the license, the resources, or the structure to lead. So if any of that sounds familiar, if you found yourself hearing the same complaints again and again, or patching fixes that don't stick, or just wondering, why is this still so hard? Let us know in the chat if it resonates. Okay, I just want to go back to some of the answers from before. So what stalls progress? What's been challenging? We have getting beyond signs and an agreement with that, 100%. Moving on to the next core challenge that we see everywhere, disjointed planning. So most healthcare systems are incredibly dynamic, right? You've got new buildings, mergers, renovations, rebrands, change is constant. But the planning around wayfinding often doesn't keep up, as we talked about. And why is that? Every team, every site, and every department is solving their own problems in isolation. So what do we mean by disjointed planning? You know, it's when a new ambulatory clinic opens and creates its own signage strategy, or a department moves floors and prints new signs without telling anyone, or a digital team updates patient instructions, but the physical environment doesn't match, you know, or facilities replacing signage during construction, but doesn't loop in marketing or patient experience. So each team is doing what they think is best, but there's no central coordination. So when actions are taken in silos, it creates gaps in the journey, and that causes confusion and erodes your brand trust. We often, think about this compared to airports, telling ourselves, imagine if every gate used its own color scheme or numbering system or naming conventions. It would be chaos. It would lead to stress and missed flights. Like I'd be stressed. In healthcare, the chaos affects care, which reflects on your brand. Some teammates and I were at a modern healthcare event. It was called Innovations in Patient Experience a few weeks ago. And on one of the panels was the CEO of Press Ganey, and she was talking about what she calls friction. And friction is really just any challenge a patient faces anywhere in their journey. And their data showed that 48% of patients experience friction prior to the start of their appointment. And that could be finding a doctor, making an appointment, or physically finding your appointment, right, and where you're supposed to go. And those 48% of patients are statistically less likely to recommend your brand. So what's needed is purposeful planning and alignment across departments so we can reduce the chance of friction and keep them recommending your system. We're going to hear from Lori a little later about how she was able to overcome that challenge.
Right. We heard it's not just about signs before, so now it's very clear that wayfinding goes far beyond just signage. But unfortunately, it's one of the most common misconceptions we encounter when we talk about wayfinding. We hear from our leaders, we hear from architects, we hear from maybe staff and clinicians, just put up a better sign. Can't we add a few arrows? Or let's just add another sign here. Lori, how often do you hear these comments and what goes through your mind?
I hear them very often. So typically what I'll say to them is, another sign may not fix the problem. So let's talk about what's causing the issue. As you and I both know, the more signs that go up in a space, the less people actually look at them.
Definitely. And it's similar to when everyone is shouting, no one is heard. And in the same way, when there's too much visual clutter, nothing is read. So it is very clear, wayfinding isn't just about signs, but it's an ecosystem that shapes every part of that patient journey. Signage is one component of it, very important, but it is only one component. But to have a truly supportive experience, you want to identify and connect all the pieces. So some of your other pieces are in the physical environment. When you think about naming, you think about circulation, visual cues, accessibility. When you think about your human touch points, direction from staff and volunteers, thinking about pre-arrival communications, what are people receiving before they even get on site? And digital and third-party tools are really important too. Think Google Maps. A lot of us Google to locations. So what does that tell you? So when these components all align, we can move beyond just signs into delivering an experience that feels seamless, calming, and clear. And that is actually what builds trust and sticks with people. So I know we've all been there where Google Maps drops you off at the wrong door, can't find registration because you're not at the right entrance. Or the pre-visit email uses formal names, but when you're on site, there's abbreviations that you can't quite connect. It's very frustrating and stressful. And to be honest, no matter how good the actual visit is, what stays with you is the feeling of being lost and stressed and frustrated. So Lori, drawing from your experience at Corewell, how important was it to educate the leaders and stakeholders around what wayfinding entailed, and how did you do it?
Well, it was critical. So there were some leaders that I worked with who mentioned over and over, we've tried different wayfinding things and it just hasn't worked. But in reality, they had tried new signage structure, right? And had not really taken the holistic view. So as part of our work at Blodgett, we actually have an educational PowerPoint deck that we've put through that takes our leaders through the entire patient journey, starting with where we're looking at those pre-arrival communications all the way through step by step to show them that it's much more than just signage. And then in order to create that experience for our patients, we have to consider each piece of the journey. So luckily, there were some key leaders who got it early on and became our biggest cheerleaders. But honestly, there hasn't been anyone we've shown it to who hasn't thought it made sense. In fact, I was speaking with one of our surgeons this morning, And we were talking about it, and he said, oh, thank goodness someone's handling that, because I get dinged in my surveys because it was raining and they had to walk a long way and they couldn't find their way. So I'm really glad you're going to fix that. So
Yeah,
that was a great conversation just this morning.
awesome. Yeah, I'm hearing about it today, which is great. But we're hearing it firsthand, obviously, from the conversation Lori had this morning, but some of the work that we're working with Lori and her team at Blodgett, just to see, it just shows how critical it is that key leaders understand what wayfinding is about. It's about the entire experience and not just a sign on the wall. It is operations plus environment plus communication, and they're all deeply tied to your patient experience and brand. And speaking of brand, one of the most consistent gaps that we see when working with especially healthcare systems is brand is often not in the room when wayfinding decisions are made. And why does brand belong in the room? You've already invested so much, whether it's money, resources, on building a strong brand, your values, your tones, your visual identity, your promise to the people you serve. And when the brand shows up beautifully in your campaign and your website, but crumbles in physical spaces, it creates a disconnect, which is really interesting if you think about it, because these physical spaces is often the first physical interaction your patient and visitors has with the brand. Prior to that is likely all digital. So it's a really important first touch point. And we see it happen all the time, where a signage decision is made in a construction meeting, a facility walkthrough happens without a brand review, a vendor creates signs and other environmental elements without aligning to what the brand values, voice, and look and feel should be. So what happens when that happens is your colors don't match your visual identity, the language perhaps doesn't reflect your brand tone, and the navigation experience is disconnected from your values. So imagine your patient sees a beautiful, compassionate, crafted message in your campaign, and then arrives on site to see taped up paper signs, confusing hallways, or mismatched directions. It's not just not a great feeling, but it's a bad experience that stays in your mind. So Lori, for you, when you started your mission to improve the wayfinding at a system level at Corewell, how was brand included?
So it really got momentum when we started building out our brand and physical experience guidelines first. And that was a cross-functional team from consumer experience, brand and marketing, facilities, and interior design. So that same group began meeting to develop a stronger process to be involved at the beginning of design for new construction. Because what we were finding was that we were all brought in kind of after the building was built, and it was sort of too late to have any impact in the wayfinding in the building. So that really led to deepening the work at Blodgett and then identifying the need for system standards. We asked Brand Active to lead us through the process because they had just helped us, as John talked about the Roman Empire. All of our exterior rebranding happened very quickly, and they were so easy to work with that when we needed to take this next step, we knew they were the right choice for us.
Yeah, and we love working with Lori and her team. But the experience working together laid the foundation for our partnership, now continued into wayfinding. So once the care team came together to build that wayfinding system for Corewell, it created an alignment that is needed to drive that meaningful change. And what we have developed are tools and standards that the team can use going forward as well. And we were happy to help carry kind of that consistency across every part of the experience. I saw in the chat something about governance and maintenance. So this all goes into the tools and standards. And then what we've come to realize is that organizations that keep their brand alive across every touch point, physical, digital, human, are the ones that stand out. You bring branding into your wayfinding decision. You can create an experience that's clear, calming, and aligned. Again, the one that people will remember and introduce to their families and friends.
Okay, so one of the most critical and I think often overlooked steps in any successful wayfinding initiative is securing that organizational and cross-functional buy-in. But like, why is this so hard to do? It goes back to everyone touching it, no one owning it. So it's a challenge to even get started. It's not part of any one department's strategic goals or business plan, right? I'm going to reference the Modern Healthcare event and the Innovations Patient Experience again, because it had some really good stuff. So senior leaders from Johns Hopkins, Advocate Health, Summit Health, UPenn Healthcare, Emory Healthcare, they all agreed that everyone owns patient experience. You just need to understand your part. So with that said, Lori, where did you start?
Yeah, so at Corewell Health, again, we started with that local challenge at Blodgett. The main entrance was shut down, parking was rerouted, a new outpatient building was completely remodeled, and there was very little wayfinding integration into the hospital. So departments started to put up their own signs, and they were the dreaded paper signs. Teams were trying to help, but the experience was really becoming fragmented. And we knew it wasn't just a Blodgett issue, it was a system level issue. So we brought that cross-functional team, consumer experience, brand, facilities, interior design, the parking lead, registration leads, and we brought everyone into a patient experience workshop. We brought them on site to Blodgett for 2 days. We walked through real patient journeys. So we used Google Maps, we read appointment instructions, and then we tried to find our way. And even we got confused, and we work there. So that shared experience of really putting them physically in the patient's shoes was really the turning point. We took time people wouldn't normally take and helped them see the problem, not just with their heads, but with their hearts. And that really helped us secure buy-in from operational leaders and executives to move this whole process forward.
Yeah, as part of that day, it was fun to see, leaders really getting energized around trying to understand the instructions that were in front of them that, a patient would have received and interpret it to find their way and really see those challenges. And I love what you said, Lori. It's the perfect first steps. You got the right people involved. You had them rally around something. In your case, it was, 5, 6, 7 departments and realizing the frustration through walking in your patient's shoes. So what we often do is a stakeholder analysis, and we map out who knows the space, who knows the operation, who knows the patients, who's going to be an ally, who's got influence, who do we need to win over. We then use we use interviews for the stakeholders to understand the challenges and what people should rally around. So the next step is getting really clear on who owns what. Who approves naming conventions, who ensures that new signage aligns with brand standards, who's responsible when a site is renovated or a new building opens. And that one's key because wayfinding standards are not black and white. They're situational. The strategy needs to be applied to a site, first on paper and then validated. So getting clear on these is a key part of moving from one-offs to a system.
Yes, John, and don't forget about leadership. So at Blodgett, when we were doing a first pilot ahead of this, there was a leader that was really bought into looking for improvements, and then he retired. So we continued to work and then realized it was a bigger problem beyond Blodgett, so started to get buy-ins at higher levels, while still understanding how important local leader buy-in is if you want to be able to maintain the work you've done even after you leave.
Yeah, so Lori and John both highlighted something very powerful, which is around having that shared experience. And that is what creates alignment across all levels. And Lori, I was in that workshop. It was really fun to see. And I also see in the chat, take times others don't normally take. I think that was really important. That workshop was really important because we saw people come together, people that may not normally work with each other day to day, and starting to understand not just about the patient experience, but understanding what each other does, which then created alignment and really helped shape our wayfinding. All right. However, buy-in isn't just about people, it's also about funding. So there are opportunities to embed wayfinding into your capital planning. So when you think about integrating wayfinding into new construction, renovation, brand initiatives, things that are already happening, so it can be included as part of capital budgets from the start. Or if you try to align your wayfinding efforts with broader strategic goals like improving patient experience, safety, or satisfaction, that will strengthen the business case for the investment. And ultimately, when you think about it, even small low-cost steps like aligning nomenclature, addressing Google Map pins, or training staff can be meaningful improvements in the wayfinding experience. All right. And as we all know by now, wayfinding is not simple. But when we take a step back and look, there are standards for everything else. There's brand standards, fleet standards, signage standards, digital standards. Why not wayfinding? There are a lot of dots to connect in wayfinding, and they are not going to connect themselves. So it really is about connecting brand, operations, and facilities and experience all under one shared vision so that you get away from those quick one-off fixes. And then you start looking at it from a strategic level. You can build a framework that's scalable across the whole system. And again, not just addressing one single site. And also what's really important is using pilot sites to build the trust within your organization to ensure the focus stays on the entire experience and not just the signs. So Lori, how did you see this play out at Corewell?
Yeah, at Corewell Health, we really learned this firsthand, right? So early on, we were trying to fix one site, and it was a challenge because we really realized the root cause was a lack of shared standards. We knew we needed to define a system strategy to have this reference point, something we could point to and say, this is what good looks like. And that really became the backbone of our strategy. But it wasn't easy because one, people want results now, and we had to say, not yet. but it was because we were building something bigger, something that we knew could work across the system and not just solve one site's pain. So that message, it's a no for now, so we can do it right later, was hard to deliver, and it's still hard for me. I have such a desire to help people, and I never want it to be hard for our patients to navigate, but it's paying off. People are engaged. We're getting ready to implement with clarity and confidence, and it's really generated a lot of excitement at other locations for when we get through this first pilot.
Yeah, and I completely
just
agree.
Gonna jump in there, Viv. One more thing from the patient experience event. There was a sentiment about figuring out what you can do now, right, versus what you should do longer term to get more benefit, right? So it's about being intentional, right? Getting those wins now while also planning for larger benefit longer term.
Yeah, definitely. And Lori, I'm with you there. No for now is really hard to say, especially when you know it's coming from well-intended people asking for help.
Right.
But this will all pay off in the end. You know, creating a strategy, having discipline, and a journey that works. It will connect the pieces and test them, make sure they work. And what you'll end up with is you can scale with intention. You're not just helping people find their way. You're shaping an experience they'll remember even after they leave.
Okay, so at this point, it's totally normal if you're thinking, okay, this makes sense, but where should I even begin? And the answer's on the screen, right where you are. So you don't need to wait for a system-wide budget. You don't need to have a full governance model finalized. You just need a clear first step and that commitment to doing intentional work, right? So here are some realistic places you could start. You could conduct a walkthrough with your facility, like you're a visitor, like Lori did. What do you notice? What feels unclear? You could collect examples of confusing signage or mixed messages, right? Maybe it's email headers that don't match building directories or department names that differ from what's online. Talk to the volunteers or front desk staff, right? They have the best insights. They're the ones answering wayfinding questions all day, every day. Go back to your patient surveys, pull comments around confusion or arrival experience or signage, and then start a conversation. Invite marketing, facilities, patient experience, and share your findings, right? Each of these steps is doable, meaningful, and can unlock that momentum you need to get going, right? The key here is to shift from reactive problem solving to proactive planning, even if you're starting small. So in our work, we've seen some of the biggest changes begin with a single audit, a workshop, or a pilot project sparked by one team, as Lori's talked about a lot. It's not about doing everything at once. It's about building a foundation so that every next decision is better aligned and on the right track. So again, start where you are with what you have and commit to getting it right going forward. It's the opportunity to improve the experience and your brand. And with that, I have a question to Lori. Where did you feel confident starting, and where did you think you had gaps?
So I think we felt confident that we understood most of the problem, and we knew we needed to look at the whole journey. But as a small core team, we weren't sure we had the right clout, really, that a company like Brand Active could bring to help us spread it across our whole new system. And we really, really wanted to get it right. So bringing in Brand Active ensured we could build out the best process possible. They had the ability to build out best in practice models, tools, and examples for us to use in building out our logic and planning process. And that was really helpful as we were going through this process and gaining a lot of buy-in from key stakeholders.
Yeah, and it's been a lot of fun working with you and your team. What are the expectations for the future?
Sure. So we have the ability to track a question in our Qualtrics patient experience surveys that is around the ease of the overall arrival experience. And so we know right now, Blodgett, where we're doing this pilot, scores quite a bit lower than the system overall average. And many of those comments reference parking, signage, wayfinding. So I'm really expecting to see those scores jump once we implement this entire strategy.
All right, and one final question, what are you excited about?
So just being able to make it easier for our patients. I talk to patients, family members, other teammates who just talk about how difficult it is to navigate in our buildings, in our buildings. And so I think it's already so stressful when someone's coming for a medical procedure. This piece, if you can't find your way, how much more worse is it for people? So if I can take that part of the stress away from people and make that piece easier, then I'll feel like we've made it.
Yeah, absolutely. So want to do one more audience poll. It's going to be multiple choice. What's one realistic first step you can take to further your wayfinding improvements tomorrow?
And again, you can click on the screen and it will submit for you. I love all of the above. All right. Conduct a walkthrough with your facility like you're the first-time visitor. That's a winner. That we obviously find that very helpful, and we did that at the workshop with Lori and her team as well, and that was definitely one of the best activities I think we've done that day. And while doing your walkthrough, you could also talk to your volunteer and front staff. And then reviewing patient comments, that's one. I'm sure you all collect surveys. That's an easy one to do. And starting a conversation is really, really quite important as well to get going.
So can I just say, I saw nobody picked the collect samples of confusing signage and messages. So your phones are not like mine that are full of sign examples more than of my children.
Well, now that we've told them today, maybe they will. And once you see it, you cannot unsee it. So
that's right.
Okay, so thank you, everyone. We're going to wrap up with some Q&A. So if you have questions, you can put it in the chat, and we'll go through it. Okay, Robert asks, other than patient experience surveys, how is success measured? Lori, do you want to take this?
Sure. So a few things that we look at are how often are team members not having to stop and help direct people because people know how to find their way. So we do a lot of observation in spaces after we've made changes, and we just watch people. So are people looking lost? Are they still seeming like they don't know where to go? Do we see team members stopping to help them? And so when we see that lessening, then we celebrate that for sure.
Yeah, and I will add to Lori's point, I've been to my share of hospital walkthroughs, and when I see team members, at, especially registration and front desk, create their own tools to help people navigate, I think that's also a sign. But it's also a good way to track, like if your team member stops making their own tools to help people navigate, a good indicator as well. So observation is very important.
Any other questions? Okay, we have one from Liz. What is the biggest communication pain point that you ran into? And what is the key communication point that you noticed made the biggest difference? Lori, do you want to take this or?
Yep, I can start with that.
Yeah.
So I think the biggest communication pain point is that we thought we were being really deliberate in sharing information to everybody on the Blodgett campus. And then we'd still have people come and say, oh, I didn't know you were doing anything here. Can we talk, can we talk about wayfinding? We need to do something. I didn't know anything was happening. And so it's really just getting information out there often and in different forums. And I've made our Blodgett presentation probably 50 times now to different leaders as they've asked. And I just think you can't over communicate ever.
Yeah, I think there's an opportunity, right, for a really thought out communication campaign. I think at Blodgett, Lori, we probably hoped that some leaders were listening, right? And a lot were, some weren't, right? They like the ideas, but not necessarily when the changes were actually going to happen. So, there's an opportunity there to really get focused and create, a short, medium, and long-term communication campaign.
Mm-hmm.
Okay. Any other questions? Okay. Well, if there are no other questions, I thank you all for joining. Hopefully you learned something. Oh, there's a question. Given finance is essential in gaining sign-in, I've chosen on-time arrival, which also gains support from our registration hubs. On-time impacts surgery, patient appointments. Oh, definitely. So
yeah, definitely. That's a really important one. And we have done tracking of that over time, but actually we just talked about that metric again this week as a really important indicator. We were trying to go after late arrivals and no-shows, and that was a much harder metric to track because people track it in different ways within different departments. But the on-time arrival definitely is a place that we're going to be looking at it as well.
Yeah, I was actually talking about this with a surgeon recently who was talking about troubles they were having with registration and how it can affect the entire day for a surgery room and creates a need to reschedule patients. And obviously that has a huge effect on efficiencies and bottom line.
Yeah, that actually reminds me of my own appointment that I was really late for because I couldn't find registration and I was probably about an hour late. Luckily, I got in, but I was kind of ready to have to reschedule and come back again. So that's definitely an essential one.
Okay, Marcus says, I encourage everyone to go and sit in a clinic or hospital lobby, campus, and just observe patient behavior. It can be so eye-opening. I've often found that many people will skip signage and look for the first human, especially when they're older or stressed about their visit. Simplifying and having a well-planned wayfinding system can really help ease the way. It also helps staff by minimizing disruptions. I think that's bang on, Marcus. And I think there was a quote that Viv said early on that we've heard, which is we can't just keep designing for the middle, right? We have to be designing for different populations in ways that will work for them, whether that's people who speak different languages, people of different ages, whatever it might be, color blindness, things that we need different strategies that are going to work for all the different populations.
Yes, I think that's spot on. And I'm always amazed when I talk, with leaders or people that are asking, and I say, what do you see when you sit and observe? And they're like, oh, I've never done that. And it's the first thing that I tell people to do. Just sit in your space and see what you see. And it's always very eye-opening.
Yeah. Going back to my consultant days for hospitality, a front desk check-in process was getting, just crushed in their scores on how guests were rating them. And we went and watched, and we saw it had nothing to do with the service that was being provided. It had to do with guests coming up and going to the concierge desk before the front desk, and then they were being pointed to the wrong place to go to for the front desk line. So they ended up cutting the line and then being sent to the back of the line, and that created the bad experience. But the check-in agents, the front desk agents, were actually providing great service. So, really getting to the root cause of the problem. Robert says, surgery patients arrive many times before we are at full staff, and all they may have is signage to guide them. Yes, exactly. So, if that's somebody that's going to be looking for a human, they're not going to find the human. And ideally, we're creating strategies that do guide the person without requiring a human.
Yeah, and that's actually a really good point, because we're trending towards a self-serve situation I see it across different industries, not just healthcare. But when you think about airports, everything is pretty much self-serve. You go to the gate, you check in, you drop off your baggage, you get your own luggage tag, everything right up until the gate is really self-serve. So we're starting to see the same thing in healthcare, where whether it's a demographic thing, or it's a cultural shift, or sometimes it's budgets and resource limitations, there is a component of self-service that needs to happen, and which actually is really important then, that your whole patient journey between your different touch points and where they kind of start to interact. So when you get off digital onto a physical space, those interactions and those planning points then become really important in having a holistic experience map and strategy. I know, I agree. And the airline prices aren't going down, so I don't know. I don't know how I feel about that one.
Okay. With 5 minutes before the hour, I think we'll end it there, so everybody has time to get to their next meeting or whatever it might be at 3 o'clock Eastern time. Again, thank you everyone for joining. Thank you for the engagement and the questions. If you have any more questions, there should be a button to press to book a meeting with Claire, one of my colleagues. We'd love to chat more about wayfinding with you, or hear more about what challenges you might be experiencing. Everyone have a great rest of their day. Thanks.
Thank you.
Thank you, everyone.